it's my honor and privilege to introduce a member of the Nayanta University founding group, Satish Reddy. I will read out the profile and then we'll move quickly into the conversation. So, Satish Reddy is the chairman of Dr. Reddy's Laboratories. He joined the company in 1993 and since then has held positions of increased responsibility. Satish led the organization's transition from a uni-focused manufacturers of APIs, active pharmaceutical ingredients, to a company that moved up the value chain with a diverse product portfolio of finished dosage formulations. He oversaw the expansion and establishing of a strong footprint for Dr. Reddy's finished dosage products in Russia, China and other emerging markets. He was just telling me they have 800 employees in Russia. As an active member of major industry associations and government panels, Satish plays a key role in shaping policies concerning the pharmaceutical sector that include India's patent law, drug pricing and the Drugs and Cosmetics Act. He is a member of the CII Governing Council and a member of the International Generic and Biosimilar Medicines Association CEO Advisory Committee. In his role as a member of the Board of Governors to the Young India Skills University, Satish has been instrumental in setting up the School of Life Sciences at the Skills University in the state of Telangana, a university with 17 different industry-focused schools for equipping students with job-oriented skills. He's participated in various national committees on the India G20 presidency for 2023. He was the president of the Indian Pharmaceutical Alliance, a premier industry association of leading research-based Indian companies from 2019 to 21 and 2013 to 15. In his varied roles and responsibilities entrusted by the Government of India, Satish was the chairman of the Life Sciences Skill Development Council under NSDC, the chairman of the Board of Governors of NIPER Hyderabad, a member of the Drugs Technical Advisory Board of India, and also the chairman of the Board of Governors of the National Safety Council. He drives the organization's CSR initiatives that include working to help the less privileged create sustainable livelihoods through appropriate vocational education, focus in the area of child rights and education, safe drinking water, agricultural export marketing support, and other much needed empowerment initiatives that India needs. Satish is also one of the directors of Dr. Reddy's Institute of Life Sciences, a not-for-profit institute engaged in pioneering and innovative research in unifying areas of chemistry, biology, and chemical biology. He was identified as a young global leader for 2007 by the World Economic Forum and was presented with the IBLA India Corporate Citizen of the Year awarded by CNBC in 2005 for his contributions to CSR. He holds a degree in chemical engineering from Osmania University and an MS in medicinal chemistry from Purdue University, USA, where he received the 2009 Distinguished Alumnus Award from the School of Pharmacy and Pharmaceutical Sciences. He is an industry leader as well as a leader of one of India's most dynamic pharmaceutical companies. Thank you for your time and for making the time to come here. So a round of applause. We'll jump quickly into the conversation. So I have probably had the privilege of interacting with you 4 to 5 times, and each time one of the things that has come through is that your father is this inspirational presence in your life, right? So could you tell us something about your early experiences with him, how he shaped your thinking, and we'll just kind of build it from there.
So thank you, Ranjan. It's great to be here today, this evening. I was hoping to attend at least a couple of sessions in the afternoon, but unfortunately it's been a very hectic schedule, so I just couldn't make it in time. But I believe everything is going well. So certainly hope to have an interesting session, here at least to, share a few thoughts from my side, especially the first one you asked, Ranjan, especially that, both at a personal level, of course, it was my father, of course, but even from the company's side, right? So it's been a lot of inspiration that all of us draw from his journey, his life, in terms of what he thought. So just a few things that come on top of the mind. One is clearly the vision thing, right? So if I were to say it at a very personal level as his son, even when growing up, the way he used to talk about, the work he was doing, whether it was in IDPL where he started, because his background is that on the day I was born, incidentally, June 9th, 1967, he got his first job in Hyderabad, because we are originally not from Hyderabad, the family. He got his first job in IDPL, which is a public sector enterprise in those days, large public sector enterprise. Interestingly, with a Russian collaboration, since we talked about Russia a little bit in those days. So even from that very young age, right? So since I was say maybe 6, 7 years old, those things still keep coming back to my mind about, he used to talk about what he was doing in IDPL, the kind of work he was doing. So it was all science, what kind of a process, although I never understood even a single word of it at that point of time, but then he used to talk about it. So it was very expansive in the way he used to talk about it, a lot of excitement on science, on what they were able to achieve at his work. But then as I was growing up, especially when he started his entrepreneurial journey, because before Dr. Reddy's, there were 2 other ventures, right? So that's also, the growing phase of, me in my life, as well as his entrepreneurial journey. A lot of it was about this vision thing, saying what did he want to build, right? So again, if you put it back in context, somebody who started with a scientist at, IDPL, talking about building a multinational company, in those days, right? So was something unimaginable. You think it's some kind of a dream, but he had the conviction to do it. And what you see later on is certainly history, because that was the kind of thinking. Because in the sense, from a personal level, what I could say is anything that he thought of, he would share. Right? It was on top of the mind. It was not about, oh, he's a kid or this thing. Same also happens even within the company. There are a lot of employees who remember him, who always keep talking about saying, but sir, the only time I met Dr. Reddy, he talked about a lot of chemistry. He talked about, where he wanted this company to go. And that person, for example, would say, all this chemistry part I could never understand, but the sparkle in his eyes, the kind of conviction he had, the dream that he had was the word which they always keep using, was something very inspiring. So the vision, I would say, was top of the mind. Second, probably would be, the delegation, right, and the implicit trust that he had on people. That in fact is a core value we also try to practice within the company, because the important thing is to empower people finally. Again, all these are management terms, but if you actually see the experience, that I had with my father, again, at a personal level, it was all about trust. Even at a very young age, for example, I keep still teasing my mother about it. When you're in your adolescent age, so that's the time you need a lot of money, for doing things. It's like you want to spend time with your friends, you want to go out, and you want to do things like that. I would go ask my mother, and it's like she would give me a princely sum of 10 rupees for the day and say, it's like, go spend on whatever you want, but also give me an account at the end of the day. That was my mother. In those days, all these are like 10 rupees is nothing now, but I'm just saying in those days. And then I would go to my father, he would say, oh, there's my wallet, take whatever you want. And he said that with a very implicit trust that I would not misuse anything, but he also wanted me to have a good time. He understood the whole thing. So that's how it used to be. And then as time went by, a lot of things within the family, whatever were the responsibilities, he used to delegate it to me. Because he thought I was capable of doing it. Although sometimes, most of the times, I wouldn't know how to deal with it. But because he put me in the position, it gave me the responsibility. So I would deal with it. When it came to issues to deal with. It would be, say, for example, either the construction of our first house when I was, just hardly like a teenager, or it would be, things to handle in terms of, finances for the family. Just to keep account of, how things are and things like that. Those were the kind of things he used to dedicate. That was on a personal life. Same thing when he practiced in the company. I'm just relating both. This whole delegation. When he started Dr. Reddy's, the third venture, which was completely on his own because he didn't want any more partners, he wanted to be on his own. He was always the chairman of the company. For example, in Dr. Reddy's, my predecessor, was Mr. M.P. Chari, who worked with him in IDPL, who also worked as a works manager in one of his entrepreneurial ventures. So when Dr. Reddy's was formed, Mr. Chari was the managing director. Not only that, you might find it surprising, but he offered him 25% stake in the company at that point of time, right? So that was his way of, thinking, because it also relates to the third part. But just to finish this aspect, he trusted people implicitly. He trusted them on their capabilities, and he completely delegated responsibility to them. So he was more the visionary. He was more thinking about which product to launch. He was more behind the science, making sure that things go and all that. But when it came to day-to-day operations, it was Mr. Chari. But then he would get involved, especially in the research part of it. So that's where his heart was, and that's where the company's core capability was. That's where he was into. So trust, delegation, responsibility. The last part of it, I would say also, was his large-heartedness. Right, so which also comes in at different points of time. I just mentioned about Mr. Chari. That's again unprecedented in the industry in those days at least. I don't see an example there where somebody would do that. He would start a company and then 25% he would give to somebody who was previously just his plant manager. Right, so that kind of a thing. Make him the managing director, but then do that. Again, the success of the company actually shows that it worked. In this case, it's not only in this case, but even in the other case. A couple of things that he did. He was also very large-hearted in terms of the way he thought about it. Even if you see the social aspect of it, the foundation that you're familiar with, plus a lot of other, things. I mean, he never used the word philanthropy in his life. But then if you actually paint out the picture of philanthropist, that was really him. But in the kind of organizations, the institutions that he built, nothing to do with the business, but on the other side, bringing the same level of conviction and all that, there was a lot of large-heartedness in that because at that point of time, because it was all about funds, right? So it was his personal funds that he put in to begin with. Later on, as an institution to build it up, he went and actively fundraised from different organizations, which also he did. I mean, just imagine a chairman of Dr. Reddy's Laboratories, a very successful pharmaceutical company, going and reaching out to people like MSDF, Accenture, and saying that please fund my foundation for so-and-so programs because this is what we want to do in terms of scaling up. So that was the kind of thinking that he had. Large-hearted by nature, also wanted to make sure that he wanted the best at all points of time. So
when you read the book, one of the things that comes across is this trust bit. And there were occasions where I think fairly senior leaders also left at difficult points in time.
Sure.
But the trust didn't dilute. And
it didn't. It didn't because, it's interesting you bring that out from the book because, they were very senior people in the company, people at the level of managing director of one of the companies who left, started his own company. It was a very difficult situation because he left with, 2/3 of the workforce of that company. Imagine doing that. 6 years, we have toiled hard. It's became a very successful company called Cheminor Drugs, which we later merged with Dr. Reddy's. But the managing director left with 2/3 of the people. In fact, me joining the company, when I joined in 1993, the head of R&D, which is again the heart of the organization, the people who develop the products and scale it up and then take it to the market, that team left without any records being left behind. Right, so we face that kind of a situation also. But the conviction is always there because we want to empower people. Again, the people who have left the company have all went on to become very, very big. It's also listed companies. One of it is a listed company, so you know who it is. But you see that it's like we still have the implicit trust in people. We still operate with that same mindset. Even now, if you talk to any of our senior management, the amount of freedom that we give them, but with responsibility, is of a very high degree. Because we believe in the power of the individual in terms of unleashing his potential.
There are a couple in my building. There's tremendous goodwill when I meet your senior leaders. So you spoke about vision, and in other interviews you've said that the vision has kind of been, because people have asked, how has this company stayed together? You've gone through family transitions. And you've talked about vision being unifying. In this program, we've talked about company level, industry level, country level. Could you talk about, because I think that's reflected in Dr. Reddy's, that there is a vision for the company, but there is also a vision for the Indian pharmaceutical industry. To talk about both of those, I think.
Sure, maybe I'll just give a bit of a background because I think most of you, in fact all of you probably are not from the pharmaceutical industry unless you have worked in the pharmaceutical industry before, but let's just give a background of how the pharmaceutical industry looks like and then I'll come to specifically this part. So Indian pharmaceutical industry, the defining moment was 1970. Why it is important is the then Prime Minister Indira Gandhi passed the patent law, the Indian Patents Act at that point of time, which said that that we will not recognize the product patents of other inventions coming in from overseas, but we will only recognize process patents. What it translates to, at that point of time is, before 1970, it was multinationals, the Pfizers, Novartis, all these big companies, whom you would be familiar with. It was only their products being sold in the country at almost like Western kind of prices. So if there's $1 there, equivalent of the Indian rupees. So what you would find as a result is largely out of reach of people in those days. You're talking about 1970s or even before that. India was a poor country, let's face it, at that point of time. That was the situation, one. Second thing is, even the raw materials, the active ingredients, which is we call loosely as bulk drugs, but actually it's called active pharmaceutical ingredients as a normal terminology. This was either imported or even regulated while being imported. What I mean by that is there used to be, maybe Naushad, you can relate to it. There used to be some canalization or something they used to call, there was STC in those days, which was canalizing the imports, which means how much you can import, the declarations you had to go through. It was kind of restricted in terms of.
It was almost like a quota, and you had to operate
it was like quota, actually.
Within
That's
that
what
quota.
I was looking for. Yeah. It was almost like a quota. That was a kind of a thing. So which means.
Yeah.
Absolutely, import licenses was
and
also
there was certain
thing.
Fixed quantity with
absolutely.
That license.
And also, if you remember, in those days there was also this how much capacity, which means how much you can make, was also dictated by the government. So you're living in a situation like that, right? So which means the medicines were not reaching the people, neither at the prices nor at the volumes, which is required for treatment. Of course, India is not like the Western countries where you don't have much of insurance or anything which is covering up, and which is able to reimburse. So you had this very big, very difficult situation where you had to depend on multinationals for the products coming in. They were not affordable, and also you had these restrictions. So that was the situation. What this particular act did, why I call it as defining movement, is because products were no longer going to be recognized, product patents, which means if there was a product, take any product like ciprofloxacin as an example, and a common antibiotic that you see, if that was by a multinational being sold in the country at that point of time, an Indian company could then innovate on the process side and still launch the product as ciprofloxacin with a brand, and you can market it, whereas this would not be allowed overseas. Right? So I hope you're clear with how it translates to that. So that spawned entrepreneurs like Dr. Reddy. He was in the public sector, worked for about 6-7 years, and then he started his first entrepreneurial venture. And when he started doing that, he started with active pharmaceutical ingredients, which is the bulk drugs in loose terminology in terms of what he started with. Again, what was his strength? The scientific strength, because he had that experience in IDPL, but then he moved it towards a product called metronidazole. Flagell, if anybody would be familiar with, that active ingredient was this, metronidazole. So his very first venture, Uniloids, actually made that. The difference that Patents Act made was, because it was by an Indian company, he made it in a large scale. He also was able to price it affordably as for the finished dosage people, because right now, at that point of time, metronidazole was sold to Indian formulators who could then price it more affordably. What does it do? Improves the reach, right? So in terms of accessibility, affordability, that's something which came to define the industry in the very initial phase, right? So you're talking about, say, maybe 76 or so around that time to almost 1990, when the second phase got unleashed, which is, again, all of you are familiar with, liberalization. Right, so just as the company started to grow, we were also exporting at that point of time, right? So why it's important for a pharmaceutical industry, again, it applies to other industries, it's the issue of quality standards, highly regulated industry, right? So if we were to sell anything in the US, we need to be inspected by the US FDA. It is very evolved, it's very stringent, it's very difficult to pass, right? So when the Dr. Reddy started in 1984, our first FDA approval came in 1987. If I still remember those days, so in those days there was none of these videos and all that. So, I mean, in the streaming or anything like that, or Google at that point of time. So I still remember there used to be these cassettes which somebody in the US would send on saying how to pass an FDA inspection. And then you have to kind of decipher it to, what way you were doing in your plants, hire consultants, at a very high price. But then we went through it. And then we could export. So same thing, if you see in the second phase, it was all about standards, it was all about exports, and then liberalization allowed us access to international markets, where you can also be directly present, right? So that's the second part. And then there's evolution of the industry itself in terms of what Indian companies were doing, and also Dr. Reddy's at the point of time, because like I said, we were making active ingredients, the bulk drugs, selling it to formulators. We also went into the formulations, selling it in India. And then one of the first markets, since we were talking about it, was Russia, right? So again, we were talking about the year 1992, right? So that was the start of the liberalization at that point of time. Soviet was just breaking up. And again, there is no management strategy or something that I can talk of. It was just that Dr. Reddy happened to be by chance in one of the conferences in Russia, entrepreneur, visionary. He saw an opportunity there and then put some plan together, which was basically to say, let's register our products first and then think about what business will come out there. Identified one person, one Mr. Venugopal at the point of time, who had no pharmaceutical background. He was from the merchant navy and he was fluent in Russia. He spent a lot of time there. So it's again very entrepreneurial. That's why you can't write any theory behind why this happened. It just happened by chance. And then you put it all together, products get registered in Russia, and within like 3-4 years since we started in Russia, we were exporting huge volumes of some of our leading brands, Ciprolet, Omaze, all those brands registered in Russia and then being paid in advance in dollars by the government of Russia, and it was hugely profitable. Just to give an example of how internationalization worked. But the biggest market is the US. That's where we entered in generics. Again, it also talks about perseverance as one of the important values, because we would have started this journey sometime in maybe 94 or something like that, establishing a small office in New Jersey. Our first commercial sale came 10 years later. There was a big project that we put up in 1996 to sell to the US, went through the inspections, and the final commercial sale took place in sometime in 2001. It's very difficult, because the company was very small at the time. It was publicly listed. The shareholders would look for returns, but then we had invested a lot. We were highly leveraged. These were the situations we went through. But once the commercialization happened of the products, and it's not an easy thing. I won't get through the details. But the thing is, the product that we sold to begin with in the US was again hugely profitable. And also we were one of the early entrants into the market, first mover advantage. And then it was history after that. Our biggest sales even now come from the US and will continue to do so. So at this point of time. So relating back to the question, just to summarize it, because the story itself tells you how the thing, in terms of vision, it was all about, saying that you started with what you are good at, right, which is science, technology, APIs to begin with, but very quickly not just rely on that, to also see the next step, which is formulations, also see how the trends outside are shaping up, internationalization, in the most difficult markets where you don't anticipate anything, got into Russia. And then when it came to high standards to be maintained, the US, these two are the biggest market. US is a very, very large market on the generic side. And again, the difference would be that in the US, it's not a brand. It's the pharmacy. If any of you, we're prescribed medicine and you go to the pharmacy, it's the pharmacist who's telling you that, we have a generic for this, right? So that's how it works there. So it's not Dr. Reddy's known as a company there, but it's the product that's being sold. Whereas in Russia, it's your same brand. The Omaze that you get here, it's the same as what you get in Russia. So these two markets, examples of these two big markets, illustrate about how we looked into that. The last phase, and that's where I would say again, the vision part of it comes in as a unifying force for the company. All this is generics, right? So which means somebody else invented the product. You use the process patent to make something different. So there's some level of innovation, process level. But then it was all about marketing. It was all about spotting opportunity. But also in 1992, and this is the interesting part, I said 1970 was a defining part, but 2005, when the Indian Patents Act was amended as part of the TRIPS agreement, right? So, which was again happened early 90s as part of the liberalization, it was very clear to us that 2005 product patents would be recognized. It was very clear in 1995. So what does Dr. Reddy do in the year 1992? This is again unprecedented, and I'll also talk about what economists define that as that event. 1992, he starts drug discovery, which is discovering original molecules. You're talking about profits being made from bulk actives largely. You're just about to embark on internationalization of Russia and these kind of markets. And then Dr. Reddy decides to start a discovery research outfit in Hyderabad. That's what he does. What's his conviction? Again, strength of chemistry, which is very, very strong, saying that we can also innovate at a fraction of the price at which the multinationals innovate. So his whole idea at that point of time was covered by economists, which actually called him delusional, saying how can an Indian copycat, because they refer to us making blood drugs as copying those drugs. How can a copycat dream of discovering a drug, right? This is in 1993 or something, that article came out, or 94, around the time. 1997, our first discovered molecule in the field of diabetes. We were just talking about diabetes. In the field of diabetes, the first molecule called termed balaglitazone, named by my father after Lord Balaji. So Balaclitazone was licensed to Novo Nordisk, the inventor of insulin, and which is well known to all of us in the diabetes field. So that's the shift that happened there. So it's dream big, have a large vision, have the conviction to do it, take risks, be bold, and at the same time take care of your shareholders, right? So this was something which is there. Again, sorry, one last point, because you said how will it unify people within? Because every single success of the company, right, whether it was the launch in Russia, and then being successful there, or a product launch for the first time in the US, which was very unusual for an Indian company to do, or any such moves that we made, or even this licensing which you talk about. You're talking about 1997. India had still not amended its patent laws, and here's a company licensing an original discovery to Novo Nordisk. All this was unifying the company, saying that it respects science, that it takes bold risks. This is the company to be in. So that's what people used to be inspired. Sorry, long-winded answer, but
no, it's very. So you were also kind of a industry leader. So today, if you were to look at this vision and how it's evolved, how would you see the vision of the company today, and your vision for the pharma industry out of India? Maybe if you could.
Sorry, I missed that part, because again, if you see the evolution of Dr. Reddy's as a company, it also reflects what happened within the industry. So when I talked about the 1970 that patent law, that led to the rise of API industry, like in the way I described. Even Hyderabad till today is also called the bulk drug capital of India. There's a reason for that, and I mean, I shouldn't be boasting, but Dr. Reddy's is one of the responsibilities for that, and Dr. Reddy himself, because it spawned entrepreneurs like him, because a lot of people took inspiration from what he did, and very, very successful, large volume, very cost efficient, and of the very high standards, bulk drugs get made from Hyderabad until only 2000, say maybe 2005 or so, until China took over and we started buying the APIs from China. That's a different story. So one is that's the first phase of the industry. Second phase was, again, like I said, entering into emerging markets. Russia as an example. That's when Indian companies started to look very aggressively promoting their branded products in the emerging markets. I talked about Russia, for example, other markets also like South Africa at that point of time, a lot of the Southeast Asian countries, Brazil, for example, the Latin American countries, all these countries, that's where we expanded. But the biggest thing is this discovery piece, because after Dr. Reddy started this, people started late, but they got into the game, and then original discovery. And it's my father's book is titled Unfinished Agenda. That is the unfinished agenda, which is Indian discovered product is still not out in the market yet. It's 30 years since, and companies are still going at it. Even we still continue to do it in a research lab in Bangalore in the space of oncology, where we have almost like 16, 17 products in the pipeline. But it shows you that the difficulty, you spend so much, but then result takes a long time to come. But once it comes in, it changes everything. What I mean by that is Glaxo, whom you'll be very familiar with, it was an unknown company for a long time until they made a product called Zantac. Ranitidine was active ingredient, and it became a billion dollar drug, the first $1 billion drug in those days. It's how it changes the fortunes of a company. So that's the quest in terms of where we want to do that, because the next phase of the industry is really that. How do we also move towards the highest value add, which is discovery part of it. And along the way, there's also, again, a lot of terminology, but even biologics, for example, because all that I talked about our initial success was chemistry based. That's what we were strong in. But then if you see most of the products today, especially in the pipeline, a lot of these are biologics. They're naturally available within the body, proteins, and it follows a completely different process, and it's not easy. It's very complex. So that's also a thing where again Dr. Reddy's had the unique distinction of launching the world's very first biosimilar of a product called rituximab. Not for the first time in the country, a similar product to that. First time in the world, the biosimilar was made, in 2007, which again is a big leap forward for people to say that, oh, from India, it's like, a company actually made it. So, and then a lot of people got into this game, as a result of which all these very, very expensively priced products, most of them in the cancer space, by the way, become affordable. Not just in India, but also in the emerging markets to begin with. And these are the products we are also filed for the European markets. We just got the first approval very recently. We are also filed for the US. We'll also get approvals for that. So it shows the evolution of the industry, not just on the Indian side, but also in the world side, and how the journey of Dr.
I think it's both very interesting and inspiring. So one of the things I took from the book, which was very interesting, was that in the early days, the firms have always competed and collaborated. So, he talks about his relationship with Yusuf Hamid of Cipla.
Right.
He talks about the, how do you see that today? That in terms of the Indian pharmaceutical, is that there? And in your role, are you seeing that collaboration, competition mix and how it works?
Absolutely. So let me explain that. But the inspiration to that was, because in my resume you read out as, Indian Pharmaceutical Alliance. Again, it's a alliance, industry association of 25 large companies, all the top companies in India, based out of India, including a multinational also. Abbott is also part of it. But this is an association which incidentally was founded by Dr. Reddy, Dr. Yusuf Hamid, and Dr. Parvinder Singh, who was part of the Ranbaxy family, which was the largest company, Indian company, and pioneering in a lot of aspects. So they founded that. So it was initial collaboration. What was the basis of collaboration? Again, what you read out saying that, R&D based companies, which means company which were investing into R&D, whether it was for the generics market in the US or whether it was for original discovery, only these companies would come together. So the collaboration at that point of time was to influence the policy, right? So even in terms of, just to give an incidence of, the Patent Act, when it was being amended and finally being passed in 2005, it had certain clauses which actually would have finished the generic industry, right? So, but then, without getting into the details, we were able to introduce a section called 3D, section 3D, which actually prevents that. And all of us should be thankful, to the industry association, because that particular aspect continued to strengthen the industry to export generics outside, but more importantly, to also make medicines affordable in India. Because if that section 3D wasn't there, you would have been prevented from launching a lot of products which otherwise would have been part of something called evergreening by multinationals, which means they'll keep extending the patent so you can never launch it. So it's that kind of a thing which the industry was working on, and there were several other things which we were collaborating on. The most important thing again was the price control, right? I was involved in both, so that's why I could see that. But it was a collaborative effort because it was for the interest of the industry. It was for the interest of the Indian people in terms of why it was done. So because people say you're lobbying hard for your interest. It's not just the interest of the industry. It's ultimately, because of the example I described, it is for the interest of, the patients, who still want access to affordable medicines, that we were able to do these things. So we still continue to collaborate. It has gone to a different level now because, you read out about the Skills University in Telangana, which is a very recent thing, by the way, just 3-4 months ago. But at the Indian scale, what we are also doing is setting up a skilling institute. And again, this is a collaboration between pharmaceutical companies, funding it ourselves to ensure that, to meet the very, very high standards. Because some of the things you would see in papers, at different points of time is warning letters that we get, for our facilities. It's as if it's a doomsday. Sorry, it's not. It's just that, in terms of meeting the high standard of the US, there are always deficiencies because technology is going on changing. Right? If we were to give an example of injectables, aseptic processing, it requires such very, very high standards to be built. We don't have the educational institutions in India, the pharmacy educational institutions, which teach anywhere the basics of what is required for the industry. So anybody who we get as a pharmacy graduate has to start from scratch to do that. That's why we set up the Skilling Institute. The one in Telangana, what's unique is the government just thought of it just 3 months ago, right? The Chief Minister had thought of it. What we're doing there is also offer skilling degrees, of a very high standard, so that at least it gives access to people, everywhere across, not just qualified graduates, but also people who want to do a diploma and can be certified, so that he or she can at least work as an operator with really high skills for the international standards. So it's those kind of things which this.
So the skilling is strategic in that sense.
It's very strategic. So that's why I said, in terms of collaboration, that's why the industry leaders, when they get together, not only for the good of the industry on the policies, it's also about development activities. So we also collaborate very, very closely.
So the interesting thing is the collaboration has continued after the original 3 founders who probably had a personal relationship, but it's
absolutely,
it's kind of.
It is.
So one theme that comes across, and you would normally think of it as a tension, right? Saying that innovation in this industry is high risk, high reward, long term, needs deep pockets, and affordability. So how do you look at this affordability and innovation? Because even at the back of the book, it talks about affordability and innovation.
It is.
How do you see this?
That's a really good question, because again, in the way I described the structure of the business, right? So let me just take it in 2 parts, right? So when you take just the generic side of it, active ingredients and the generics part, the formulations and the whole part. So what's the business there? The business is you have to be first in the market so that you're able to challenge the innovator when it comes to the US. Or if you launch a brand in India, you're one of the first to launch it, brand it and then take it to emerging markets. So here the important thing is cost, right? All the way from the API till the time you make the formulation so that you can be competitive. So it also requires innovation at a certain degree, right? So that's something, companies like us, are always on top of the game on this because we can't survive otherwise, right? So even though I said Chinese displaced us in a lot of APIs, but the really important ones, oncology products, for example, or some high-valued products, they're no competition to us even today. That's because we continuously innovate on the process. Even the product is established or even the product is old, we still continue to innovate. So we still have a leading position on that. So there's one degree of innovation. I just gave one example in generics, but there are several such things which keep happening there. There's a second part which I talked about, true innovation or a higher degree of innovation, let me say, which is discovery. And that's where the tension comes in, right? So because, for example, one of the things that economists, like I said, he said we were delusional in terms of what we're doing is, investors also questioned at one point of time, because when things were going good, we licensed to Novo Nordisk, then to Novartis, our discoveries, then the share price went up pretty high, but the first failure pulled the company down drastically, right? And the important component of that was the investment in R&D, which is where the tension comes in. All our earnings are from generics, APIs, and then you're investing into this high risk, high reward drug discovery. So at a point of time, our percentage of sales, R&D percentage of sales were 14%, right? Which investors said after that failure, saying company cannot sustain this, they're into uncharted territories and this is not something Dr. Reddy should look at. They should stick to their knitting, which is generics and all that. And then we were punished heavily at that point of time. Even today, if I were to just say, our valuation for that 20 products, which I said were in different stages of original discovery, does not carry any valuation at all at this point of time. Hopefully, it will change once we get to the market at some point of time and complete the unfinished agenda, which my father always had. But this is the kind of tension that we face in a company, which is, again, if you take an average of R&D spent in top companies, it's somewhere between 8 to 10%. Again, I'm talking about the leading companies, which again, Naushad and I co-authored, he authored it, I was just tagged along as a co-author, but it actually shows the dismal nature of the R&D spend in India. It's a very meager percentage. If you take from public institutions, 0.3%, Naushad, whereas, advanced economies, it's like quite high. You take pharmaceuticals, for example, you're talking about multinationals, spending almost like 15 to 20% of their sales because they can afford it, right, on discoveries. And you're talking about billions of dollars. We only have a handful of companies which have $1 billion turnover from India at this point of time. So you see the scale of the problem in terms of what it is. So when it translates to the tension that you're talking about, you make all the money and margins and everything from generics, which is a very highly competitive space, and that's where there's always tension within that space. But then you also have to keep the other arm going, which is innovation at the highest end, which is discovery, and just have the conviction and the perseverance to be there, because otherwise India will not progress to the next level. You cannot be just the generics arm of the pharmaceutical industry, for the world. If you have to show that you're capable, because we know that we have proven capabilities, we want to get to that next level, and the value, it is innovation which will get us there.
And you have to focus discovery a bit, right? You have to get...
Absolutely. Yeah. And that's where we also talk in that article saying that, the government also has to do its bit. It is not asking for just purely incentives for incentive's sake. Because it's so high risk, it also requires an ecosystem, for example. Industry and academia have to collaborate. That is non-existent in the pharma industry today, because academia is somewhere there and we were somewhere else, right? The curriculum has to change, the research has to happen in universities, for example, at the degree which it needs to be there. So all these things are, again, good problems and challenges to solve, but again, we are saying it's the government which has to pitch in and not expect just industry to do it. So, sorry, I was tagging.
So great. So industry and academia gives me kind of a good segue to... So, but before I do want to get to CSR and education, and at some point want to open to the audience also. But before that, one of the things that stood out was, I think the company has been very proactive on areas like sustainability, diversity and inclusion. We today had a conversation around gender. You all have set a 35% target on gender.
In leadership.
In leadership, in leadership. So maybe just talk a little bit about the sustainability journey of Dr. Reddy's, and then we'll come to giving back and that kind of thing.
Sure. Again, just to set the context for this, right? So because I said we started as a bulk drugs company, there was again a responsibility which again Dr. Reddy inculcated in us, saying that you're also responsible for the environment. It is not that you produced a product, you treated the effluent somewhere, and that's where the story is over. Where you discharge the effluent, and also the effluent being generated, what is the characteristics of that? It was something he paid a lot of attention to. How it translates into our business thinking is, when we set up the plants at that point of time, the first thing we used to spend a lot of money and also give a lot of focus was the effluent treatment plant. We are the first company for bulk drug activity to set up a zero liquid discharge, which means no liquid will be let out of the factory. That kind of a thing we used to do that. The water part of it we used to reuse, in fact, in terms of doing that in our plants. So it was that kind of a thing, because you don't hear it in those days because it was not mandatory. Today you have ESG terminology, reporting, all kinds of things. But your consciousness towards environment, as a philosophy of the company, was something which we practice very, very strongly. Again, to give an example, in Vizag, where we have our largest manufacturing footprint, which is where he was inspired by the Tatas. Right, when we selected the land, and there was a large piece of land because that's where we wanted a future for the next 50, 60 years to be, he was only involved in the beginning, not about what the designs for the plant was, but the landscaping. Because he wanted to create that kind of a green cover so that this lasts like a lifetime for the company. It was those kind of things which are done. Even in our plant in Bachpally, where again it's a very high value at this point of time, large space is still left only for environment. The green cover, and we don't build any tall structures and all that. It's just purely left that way. It's a factory environment where even our process development takes place. So it's a very conscious thing that we develop, say, as an example on environment. If I talk about the other part, again, let me go on the ESG formula. So that the society part of it, it was all about caring for all the stakeholders. Now they say it's something that you must do, but that was always a situation because we used to talk to our suppliers in terms of their practices. We used to, again, encourage a lot of employees to also, be caring towards the community and also volunteer their time, for a lot of things. And the whole, community and the society, in terms of giving back, it was an example which I can talk separately, but it's a long story. Dr. Reddy was leading by example, not just within the company, but even outside it, right, in terms of what can be done, because he led by example. It was not something where he was writing checks to different organizations, but actively promoted an institution called Dr. Reddy's Foundation, which I'm fortunate to chair at this point of time, in the field of education, livelihoods, a lot of things that we talk about today. There was a pioneering effort in terms of what he did, in those days. So that was the responsibility of giving back to the society. Governance was a very strong aspect. Again, we are a listed company. Initially it started as a typical Indian promoter-led company would be, which is, pack it with relatives and friends. That was a kind of governance in those days. But, once we listed on the New York Stock Exchange, in preparation for that, we set a standard of governance where in terms of independence of directors, even in terms of the number of women, before it became mandatory, by the way. We always had people, very, very high caliber who were serving on the board of directors, and true independence being practiced. Just as an example of governance at that level. And then, if we were to sum it up, sustainability itself as something, we published the first report by an Indian pharmaceutical company in 2004, right? It was not even a disclosure requirement asked for by anybody, but we used to do that. Consistently, we've been doing that. And then it became mandatory now, as part of that, BRSR report, whatever we call it now. It's all part of that, but we started pretty early in that, and then we were reporting it. So in terms of disclosure standards, in terms of the intention, in terms of the practices, that was something very seeped in quite deeply within the company, because we believed in something called triple bottom line, right? So in terms of people, profits, and planet, we seriously practice that in terms of what it is. But again, it's a concept, but this is how it's ingrained deeply within the organization, Ranjan.
So I have addressed groups of women leaders in Dr. Reddy's. They're really well integrated. You can make out when you go into these groups and issues. So what have you done to create that inclusive environment for?
Some of it, I should say, is making amends for the past, because for a very long time, so in terms of the proportion of women within the workforce, I can admit it openly now, it was like single digits for a very, very long time. When I say single digits, below 5%. So what were the reasons in those days? For example, in manufacturing, when I would ask the question to a plant manager, he would say, sir, for the third shift, we cannot, night shift for that matter, we cannot take women. What about the day shifts? It's not the most productive. When I say it's like, don't give me that bullshit, tell me exactly what's the problem. Then they would say, it's difficult to find women who would work in manufacturing. So these kind of excuses would keep coming in. And then it was something which was taken as a given, and that's how it would seep within the organization. And the result was this. When we actively started working on it to actually change the norms, we were one of the first in Hyderabad to have a night shift for women. Right? So we took care of all the aspects, safety, in terms of getting the law changed, and also encouraging women to participate with a higher pay. All these things we did to encourage more and more women to participate. And then again, if you see the functions which when we asked to hire more women, suddenly we would find that, more on desk jobs, regulatory, quality, these kind of things. They said, no, nothing doing. Manufacturing, and then the targets, quotas being set, their performance linked to that, and then it was inevitable. But once the change happened, because of the reasons when we started talking to people, they understood the difference it made. It brought in a lot of sensitivity among people. It brought in a lot of improved productivity, by the way, in terms of what was being done. Because my personal views, again, women in certain responsibilities, much more diligent than men. They can multitask at a rate in which men can't. Right? This is what I've noticed personally in our workforce. So this is something which we have continued. Then came the leadership question, right? Having a woman independent director much before it became the regulation. That also led by example, because she always used to ask at the board meetings, saying what's the proportion, how has it moved up, and then she would get into the details. She would talk to the people directly, and that would change everything. And then when we hired, even when it came for HR, we had an even more qualified HR person, the current HR person, right? We made sure that that she's part of the management council, that it was a woman. So these kind of examples, percolated within the organization, and then when we said that 35% of our leadership team, right, by 2030 would comprise of women, it's again setting a path towards that in terms of what we want to do. It's very, very clear.
So I'll open up to the audience quickly, but maybe last segue is education. I think I've always seen you very passionate when you're talking about CSR and particularly education. We've had a conversation also around Nayanta and education. In the book, your father speaks about how your US educational experience was different from your Indian education experience. Maybe if you share a bit about that, and then we'll segue to Nayanta and...
Sure. So, just to give a background, so I qualified as a chemical engineer from Usmania in Hyderabad, going through that same, I think in those days it was called something else, but now it's EAMCET exam, after qualifying through that. And then after that, I wanted to go abroad to pursue, the studies in chemical engineering. So I got an admission in Columbia for, chemical engineering. But then I chose Purdue because it had a school of pharmacy and it had medicinal chemistry. So it's a change in terms of what I was doing, because I was also wanting to get some kind of an understanding on the pharmaceutical side of it, because that was not there in the engineering side. So that's why I deliberately chose Purdue. And the experiences which my father actually, accurate memory in terms of how he captured that whole thing. My experience at that time, in a US university, we're talking about 1988 to 90, about that time, right? 1988 to 1990. At that time, when I went for a master's, experience of that was the following to me, especially when I went into the class for the first time. Obviously it was all about the infrastructure, but if you actually see how the professor comes into the class, right, very informal, dressed exactly the way you're dressed at this point of time in those days, and then with the Coke can in his hand, and then to me it was a culture shock because of the way we went through, the whole experience here being very formal, and people standing up when the professor comes in and all that. So it was very informal kind of a culture, but it was just the way the professor engaged with us. Right, a lot of sense of humor in terms of it, very casual, drawing out the people, but at the same time asking very, very piercing, incisive questions. So that made you think quite a bit, one, in experience of a classroom. Second, access to a library. In those days, again, today it's all digital, everything, you have access to lots of things, but in those days, a good library was important, right? So any doubt you had, you could walk in any time. So I go back to my, my dorm room after the whole thing is done, and then I suddenly have a doubt in terms of what the professor said. I could walk in, just having a swipe card, just walk into a library, and I would be the only person there and still feel very comfortable there. Right? It's like you had the whole library to yourself. It was that kind of a feeling. And then even this component of research, because of the course that I was doing, the research component also, in the way the professor addressed it, interestingly, I was working on compounds which were derivatives of LSD in those days, being used for Alzheimer's disease. So that's the things I was talking about. And the way the professor used to approach the subject itself, is like, casually would say, it's like, have any of you tried LSD anytime? Right? And then he would bring out the whole concept of saying why those have an application in terms of the research that we are doing, not for us to try LSD, but also just relate to it at a very, the human level, in terms of how we do it. And also the review that he used to conduct a very informal atmosphere. There was pizza being ordered into the thing. Each one is like, very casually talking about it, making jokes on, with Vijay and all that. That kind of an atmosphere is something I kind of liked it. So that the whole thing about liberal arts, as a concept, was something which was ingrained in my mind. I always used to think that, when will this come to India? Right? The whole concept where, it's like you're encouraged to think deeply in terms of the infrastructure, in terms of, it's like your engagement with your students, because the whole research concept in the way it's being done, your interactions and relationship with the professors, all those things. I was very, very fascinated with the US experience.
So this leads directly to, you're one of the founders of Nayanta. What excites you about Nayanta, and what are some of the things you'd like to see us do and do well?
Sure. No, one thing is, like I said, a lot of fascination for, liberal arts. So especially when Ashoka was being set up, because we knew Ashish Dhawan quite well, there was no hesitation between me and my brother-in-law Prasad, who was a co-chair and a managing director of the company. It's like when they said, when he just approached us, we just were like, just without any hesitation, our first, the CSR spend officially in terms of what we had to do by the time was to, Ashoka. In fact, the auditorium there is named after my father. It's called the Kallamanji Reddy Auditorium. So liberal arts as a concept, we were happy that it was coming in. Ashoka has set a great example. But then we also said, there need to be more institutions like that. So even when Nayanta came up, I was working, with Naushad for quite some time, until COVID actually put a spanner in the works for some time. Even getting into that was also the, some kind of a differentiated thing in the whole concept of liberal arts, with the involvement of the industry, right? So that's the differentiated model that we are offering. But here again, I would bring in the concept of industry very closely. Again, if I draw back to my Purdue experience, again, it's a very interesting experience, because my research project, right, was funded by Eli Lilly, multinational, against whom always we are in a legal fight, because that's part of the business model, right? So if they have it, for example, fluoxetine was a case, Prozac, right, you'll be familiar with it. When we filed a legal case, much after I came back from the US and the business, right? So we had to do a deposition in the court, right, where they call an expert witness, right? And guess who Eli Lilly invites as an expert witness from their side?
Your prof.
My prof from Purdue University, right? So when the distinguished alumnus, when you read out, the first thing I asked my prof is, Dave, look at this, it's like you went and testified against us. He said, oh, Dr. Reddy's was your company. I didn't know that. If I had known, I would have done it very differently, was what he was joking. So it's that kind of a what you call industry interaction which used to have, because any project, for it to translate to something meaningful, because even the project I was working on, at that point of time, was taken up to almost phase 3 by Eli Lilly, funded by them and taken by them. There's a confluence of those ideas coming in between industry and academic partnership, which I had witnessed firsthand. I would like to see it in some form, not just pharmaceuticals thing, but that also happening very deeply because of the connection with the industry. Because what the industry needs and what needs to come out from the academics, there has to be some kind of a collaboration. Otherwise, at least in a pharmaceutical situation at this point of time, there's nothing but mistrust, at this point of time, because academia does not trust industry, because they say that, that it's going in a very different direction, or industry has no trust at all on academics, because we feel that the kind of quality of students they produce, their inclination towards research and all that is not tuned to what the industry requires. So we are starting from that base. But if I apply it to Nayanta, coming back to Nayanta, what I would like to see clearly are that, the concept of liberal arts, encouraging very critical thinking, also something different in terms of collaborating with industry, in terms of what it can bring in to world-class standards, finally. That's what I'm looking forward to from Nayanta.
And I think we'll get there. And the idea, I think, is to really have a partnership approach to industry interaction.
Yeah.
And really two people sitting on the same side of the table and saying, what can we do together? Because otherwise, academia has always approached industry saying, give my people jobs. Yeah. Let's look. So I think that whole perspective will be.
Sure.
So, final question from me before questions, and then I'll come back, which is that, whenever you've spoken about the foundation, I've seen your eyes light up. So, what do you enjoy so much about the CSR part of the leadership role that you take?
Now, one is, again, I start off saying that, a lot of inspiration I draw from my father. This whole thing about, his whole life about giving back, right? So I've seen it at close quarters, as long as he was alive. I also learned a lot of it even after he passed away, because just to give an example, when, in our tradition, we have to immerse ashes in, 3 different rivers, because he's originally from Krishna district, Krishna Guntur, that area. So I had to immerse the ashes in the Krishna river. So the pujari who came to perform that ceremony, while all that was going on, was always talking about my father, saying how he helped, keep that institution of that priesthood alive, from his that temple. And I was finding it very puzzling, because my father was never a religious person, overtly, ever, right? So, and then that he actually helped this family and, to continue that kind of a priesthood was something quite amazing. And different stories like that at different points of time. The one which truly was inspirational was the work of the foundation, right? Because it was not just Dr. Reddy's foundation. He was also involved with something called the Nandi Foundation, which is now chaired by Anand Mahindra. That was again interesting for a different reason, because Dr. Reddy's foundation was something, he had the conviction to say that I want to give back to the society. I won't just write checks anymore. I will innovate on a lot of things. And he started off on his own. Right, started with some personal funds and then going to other people to raise funds, including Dr. Reddy's, as a company, to basically get into areas of livelihoods, education, and then now it's expanded into health and also climate action. These are still the 4 core areas of, what the foundation does. What was my experience during that time? Because while I was also handling an operating role in the company, the foundation went through some difficulties, like it does this at different points of time, because we were involved with the government in terms of livelihoods scheme, and like it happens with a lot of governments when you sign the MOU, this again at that time was Ministry of Rural Development. We scaled up, it was receiving rave reviews, but they would not pay us for doing the program, right? And then there was a problem with leadership, because again, a lot of the trust factor we talked about was left to one person. There was some, integrity issues that came up there. So I had to get into the act to clean it up, because some of those things you have to take decisions which are quite ruthless, and my father was kind of wanting me to also get into that area. So he asked me to clean it up. So that's where I got involved with the foundation, just from that very managerial, that kind of a thing. Nothing to do with, what the foundation was doing. But as and when I started getting into it, understanding what the issues was, talking to people, visiting some of the centers and all that, I found that there's a lot that we can do in this institution with the vision of what my father had, which was ultimately make it an institution. It should not depend on people because of this experience, what he had. Hire good people, I give you all the latitude to hire whomever you want, but then it should carry the core principles in terms of, what it was doing. Funding is never going to be an issue. You ask me for funds at any point of time, either I'll give it or I will go to others and ask for funds. That was his commitment to, what I had to do. So that's where I started getting involved with it on his behalf. He was still the chairman of the Dr. Reddy's Foundation, but he was working on other projects like Nandi Foundation. He was, doing lots of things. I had a lot of latitude to get into this. So what drives me now, even at this point of time, what I see is, the evolution of this foundation, one of those 4 pillars that I talked about, in terms of the impact it has on society. Again, I don't have the time to talk about it. I can always speak about it at some other forum, but especially livelihoods, because I said, that's what we started with. It's transformed into skilling. That's how even we grew into, the program also morphed into skilling, but with a focus on people with disabilities, I mean, today we are again one of the largest in that space, 45 centers across 18 states in terms of how we, skill people with disabilities and also find placement. I'm extremely happy because this placement was the most difficult thing. I approach any of the companies, they would say, yes, we want to do it, but it requires so much of change within their organization, providing infrastructure access, sensitizing people, which is a very, very difficult thing to do, because all of us assume that, it's like you hired a person with disability, that, that you would go all out to help him or her make feel comfortable. Issue is very, very different. You have to be sensitive, you have to make that person be one amongst you, and you have to be sensitive and not be sympathetic, right? Which is a lesson for me also, to know that in terms of what is to be done. So these are the kind of things that, that particular program does in terms of evolution. Just to give an example, but similar things in terms of health, wanting to transform and make an impact in the society, also working with the government in very different ways, not taking funds from them because of the past lesson, what we had, but also making sure that you work with them to see what can be done, say, for example, on health, on primary healthcare centers. We did that in manufacturing units around us, their villages. We tried to transform some of the things, and then we're taking this model to the government to see how it can then be taken on scale. So interesting experiments we do in, the foundation. So, which is where I get a lot of, pleasure in interacting with the team of people. There's a professional CEO who actually runs it. He does all the work, Shamik. But, in terms of meeting people or even, visiting some of the sites on the field, when we see disability centers or even on the agriculture and some of the programs that we do, gives me immense pleasure just to see the impact it can create by just making small tweaks, so.
So we are, I think, coming close to a time. It's been a wonderful conversation. We've been talking about arts and sciences, right? So if I just look at this, that here is a company which is founded on science. A lot of the things that set the company apart are an art. You're talking about trust. You're talking about demonstrated values of the founder. You're talking about crisis. You're talking about being world class and being proactive in introducing new things, whether it be sustainability, gender. But maybe if I can ask you to go back to the Nayanta founder hat and say, this is our first group of leadership alumni, right? If Nayanta has a leadership alumni group out of our long-term executive education, this is the first batch. What advice, is there parting advice you'd like to leave them with?
No, I think the first things first is, because we use innovation and, a lot of these changes, evolution quite a bit. My first bit would really be on this, innovation and I would say adaptability. What I mean by that is, in any industry that you're there, right, assuming that, like in my father's words, especially when we were doing so well on APIs, one of my first tasks, you also read out in the introduction, to me, his message was that feast will be over. That was his words. The feast will be over, which is APIs that, you could, make a different process and then you could scale it up. You can't keep doing it because everybody else will do that. They will do it at a lower cost. You need to move to the next thing. So it was formulations, right? While I was doing formulations, he was on to discovery, right? So innovation part of it in any part of the business, in, whatever makes sense in that part, even if it's financial services company, then the innovation actually will take you to the next step. So always keep an eye out for, saying that, how can you innovate, even if it's a commoditized thing, to go to the next step. Adaptability was more to do with the current situation, right? There are so many disruptive technologies. Even we haven't even touched that subject, but in the way discovery is going to be done in the future, the disruption that artificial intelligence can cause right now compared to other industries, it's very minor. It's only in some clinical protocols and things like that. But what it's able to do and can do, right, will change the nature of the game. So we invest heavily, for example, just like we're spending on R&D, we also spend a lot on digital. One of the highest spenders actually in the pharma industry on digital is Dr. Reddy's. Reason why we do that is if we are not ahead of the trends, we will lose our competitive position, right? So innovation, adaptability, again looking at the trends and doing that is, I think, is very important. I would only again stress on the people aspect from whatever experiences I've seen and talked about. Ultimately it's about people, right? I can't stress this more than enough because it's not just selecting the right person, but also how you empower them and also engage them and also set an example by leading yourself, in terms of the things, and also, being able to reach out to a wide spectrum of people. It's very, very important that you deal with the people aspect, because sometimes even in a company we loosely use the term soft issues. They're not really soft issues, they're wired to be at the core of the company, right? How you actually deal with it, how you lead by example, on how you create an atmosphere, the culture, what we talk about in the organization, and also live it by example. Through, like in our company we said, founder's values is what he left us with, but you're also practicing these values. From the question, I was very happy that somebody asked the question about COVID, because it comes to life, right?
In
and then
crisis.
to the next generation of people, we talk about that. Sustainability, it's a very easy discussion with Gen Z. They related to it so well, so when we talk to them about something to do with environment or something to do with this, they'll just jump at it, even if it's for a lesser position or a lesser pay, they would actually get into those kind of areas, for example. So these are the kind of things I think I would leave as a thought to the leaders, saying that, also give to that innovation, adaptability, in the overall trends, and also the people aspect to be very clear that, that
Thank you.
leave room for that.
Thank you very much.
Thanks.
Wonderful evening.